Welcome to this comprehensive lecture on diarrhea, one of the leading global causes of morbidity and preventable mortality. Diarrhea accounts for millions of outpatient visits annually and remains a top killer of children under 5 in low-resource settings. Diarrhea is defined as 3 or more loose, watery, or abnormal consistency stools within a 24-hour period. We classify diarrhea as acute under 14 days, persistent between 14 and 30 days, and chronic beyond 4 weeks. Diarrhea may be osmotic, secretory, inflammatory, or due to altered motility. Secretory diarrhea occurs when ions and water are actively secreted into the intestinal lumen. Osmotic diarrhea results from poorly absorbed solutes pulling water into the gut, such as in lactose intolerance. Inflammatory diarrhea involves mucosal damage, blood, pus, and protein loss, typically from Shigella, Salmonella, or inflammatory bowel disease. Abnormal intestinal motility reduces contact time for absorption, seen in irritable bowel syndrome or hyperthyroidism. Infectious agents remain the most common cause worldwide, spread via contaminated water, food, or person-to-person contact. Norovirus causes outbreaks. Rotavirus remains prevalent in unvaccinated children. Adenovirus and astrovirus cause prolonged symptoms. Bacterial causes include ETEC in travelers, Shigella with dysentery, Salmonella from poultry, and Vibrio cholerae causing profuse rice water stools. Protozoa such as Giardia produce chronic foul-smelling stools, while Entamoeba histolytica causes amoebic dysentery. Non-infectious causes include celiac disease, pancreatic insufficiency, hyperthyroidism, short bowel syndrome, and bile acid diarrhea. Medications like antibiotics, PPIs, metformin, colchicine, magnesium supplements, and chemotherapy frequently trigger diarrhea. Risk factors include 1. Environmental risks. Unsafe water sources, contaminated foods, and poor sanitation increases diarrhea risk. 2. Host risk factors such as infants, older adults, HIV-positive individuals, and malnourished patients. Travel to endemic regions exposes individuals to ETEC, Giardia, and norovirus. Watery stools suggest viral or secretory diarrhea, while bloody stools indicate invasive bacterial or inflammatory causes. Abdominal cramps, nausea, vomiting, fever, urgency, and tenesmus provide critical diagnostic clues. Fluid loss may be mild, moderate, or severe. Accurate assessment guides urgent management. Lethargy, weak pulse, rapid breathing, prolonged capillary refill, and low urine output signal critical dehydration. Assess duration, stool frequency, travel, recent meals, medication use, water sources, and comorbidities. Evaluate hydration status, abdominal tenderness, bowel sounds, and signs of systemic toxicity. Important tests include stool culture, PCR pathogen panels, ova and parasite microscopy, and C. difficile toxin. CBC, electrolytes, renal function, CRP, and thyroid function help evaluate systemic severity and chronic causes. CT scans detect colitis or obstruction, while colonoscopy is essential for chronic diarrhea or IBD suspicion. Rehydration is the primary treatment, regardless of diarrhea cause. ORS with the WHO-recommended reduced osmolarity formula is preferred for children and adults. Severely dehydrated or vomiting patients require rapid IV Ringer's lactate or normal saline. Antibiotics are reserved for severe bacterial diarrhea, cholera, dysentery, and confirmed C. difficile infection. These include azithromycin for traveler's diarrhea, ciprofloxacin for bacterial dysentery, and vancomycin for C. difficile. Loperamide is effective in non-bloody diarrhea but contraindicated in febrile or bloody cases. Encourage soft foods, bananas, rice, toast, soups, and avoidance of dairy if lactase deficiency is suspected. Long-term therapy targets the specific cause, glucuronide for IBS or bile acid binders for bile salt diarrhea. Hand washing with soap remains the single most effective preventive measure. Use boiled, treated, or chlorinated water. Avoid ice made from untreated water. Ensure foods are thoroughly cooked. Avoid raw vegetables in unsafe settings, and reheat leftovers properly. Rotavirus vaccination significantly reduces severe diarrhea in children under 5. Improved sanitation, waste disposal, and water treatment systems dramatically reduce disease. Thanks for watching. Comment the condition I should do next.